Okay, let's get started. So thank you so much for joining us today. This is a program overview of the Bell Seal for Workplace Mental Health. I'll be going through some of the application criteria, what the process looks like, some additional workplace mental health resources, and then we'll close it out with a Q&A. Just some housekeeping items. So please, feel free to share your name and where you're joining us from in the chat. If you do have any questions, so at any point during the presentation, you'd like to ask a question and we can hold that into the end, please put it in the Q&A section. This presentation is being recorded and will be available within 7 business days after the webinar is completed. It'll be sent to the email that you registered with along with the slides. And I am going to mention a couple URL links that will either be shared in the chat, but they'll also be available in the slides as well. So with that, let's get started. So welcome everyone. Thank you again for joining us. My name is Taylor Adams, and I am the Director of Workplace Mental Health at Mental Health America. So many of you, I'm sure, are very familiar with who we are, but I just want to provide a little bit of background here. So Mental Health America is the nation's leading community-based advocacy organization dedicated to addressing the needs of those living with mental illness and to promoting overall wellness. This is done through prevention and early intervention in different institutions like schools, universities, and workplaces. We're guided by our before stage 4 philosophy. So we believe that we should treat the emerging signs and symptoms of a mental illness long before it reaches a point of crisis, just like you would with any physical health condition. And we'll talk about how that relates more to the workplace in just a second. So I will not go into depth into why workplace mental health is super important, because you are all here because you know that. You're all here because you have a personal interest or passion for this topic, and you kind of want to learn how to do more in this space. But I did want to mention our approach to workplace mental health is focused on both 1 in 5 employees who live with a mental health condition, but also 5 in 5 employees who benefit from a supportive and psychologically safe workplace. So how can we kind of tackle both, the 1 in 5 and 5 in 5? We know that both employers and employees receive a host of benefits from a workplace that supports mental health. Just happier employees, more productive, more loyal to the organization. Employers attract and retain employees and ultimately improve overall operations. And we've been, seeing, especially in the past couple of years with the pandemic, this shift in the employer's responsibility to employee mental health. It's now becoming an expectation for, millennial generation, but also Gen Z entering into the workforce, that we are having these conversations, that we are making it a priority for workplaces that they go into. My slide skipped ahead here, but I do have a couple questions here. We don't have any polls, but if you are comfortable sharing, I'd love for you to drop that in the chat as well. But first question is, how does your organization approach workplace mental health? That's intentionally left pretty open-ended. That could be, changes that were made as a result of the pandemic. That could be, new programs that have been implemented. Whatever your company, could be a broader strategy that your organization has, but I'd love to hear if you want to drop it in the chat, and I'll share a couple of those. What your approach is. I know and I'll just give it a minute or so for that. I know personally, at MHA, it's obviously a very important thing that we think about how this applies to our own staff at MHA, as well as working with different companies and what that means. And there's been a lot of change in leadership and the way that we approach things. And it's been really exciting because there's been a focus on reducing stress for staff, especially during the pandemic. There was a lot of different requests coming in, and our leadership took the position that we really need to pay attention to this, which to me is just, the fact that they're acknowledging that, especially for those who work in a not-for-profit, industry or organization, can kind of relate to that. But some of the folks I'm going to share here in the chat, if you don't mind. I love that. So your mental health and safety is as important as your physical health, and safety is our tagline on every safety message. So that's great. Sick days can be used for mental health days. I think that's a really, it's kind of like this emerging trend that we've seen where people are now not just referring it to sick time, but saying mental health days kind of, one, reduce the stigma of that, but also reduce some of the guilt that people feel when they would take sick time for their mental health, because that's just as reasonable of an excuse to be able to use that time. Measure mental health, and we'll talk about that in a little bit, benchmarking. Mental health first aid training, having flexible schedules. So I love this, as we're all going to talk about these, touch on some of these things as we go through. So thank you so much for sharing, and we'll have another question coming up a little bit later. So first off, what is Bell Seal for Workplace Mental Health? So it is a national employer certification program to recognize employers who are committed to creating these mentally healthy workplaces. And it's really important that we stay committed to this, because we think that this is a journey. It's not an overnight thing. It's not like we solved mental health and our entire workforce is mentally healthy, but there's always being, improvements being made to strive towards that type of environment. So with Bell Seal, we wanted to recognize companies, but also provide the right resources to help get them to this point of recognition and certification. We did launch the program back in late 2019, and we've had several iterations of the program since then to kind of streamline the process, make it a little bit more accessible to employers, making sure that we are asking the right questions. So there's been quite a bit of change with the program itself, but we'll talk a little bit more about the specifics of the application in just a bit. But we have 35 certified companies for 2022. This includes companies like Yahoo, Kroger, TIAA. We have quite a few of our affiliates who have participated in this program. MHA, kind of informally went through the process ourselves, and I think this was some point in spring of last year. And we were ranked at gold level certification. So we recognize the need to improve some of the things that we want our workplace to kind of get to that next level. We've had about over 480 companies that have expressed some interest in participating in this program, who've shown some type of commitment to this space, to whether that's implementing a training, going through Bell Seal, talking about a larger strategy. And then finally, we've done an evaluation for the policies and practices that impact employee mental health for companies with over 650,000 employees. So we're at 35 companies now, but the more companies that participate, that's just the greater influence we have on the policies that directly affect employees and their mental health. So I wanted to, and I realize I talk fast, so I'm sorry, I'll slow it down a bit. I wanted to talk about the reasons why, we create this program, why we think this is so important for companies to think about. So we have our 4 program pillars here. So first one being unmatched expertise. So Mental Health America is a mental health, first and foremost, a not-for-profit mental health advocacy organization. So we've always been advocates for people living with mental illness, and this includes, in the workplace setting, advocates for employees and what's in their best interest. To put it plainly, we're not consultants, we're not an employee assistance, program provider. We're not, we're coming at a place of advocacy when we built this program, and that is our area of expertise, and the years of research that we've done have gone into this. Also, this is a distinct standard of excellence. So it is a very, and we'll talk about some of the details that's included as part of the application, but it is a very thorough, comprehensive assessment of programs and policies and different things. Because we want this recognition to carry meaning for the employers who participate. It is, it's a commitment. It's not an easy thing or process to go through. And we want people who have gone through the process to feel proud of that accomplishment. Recognition that resonates outside of your workplace. So for people who are interested in recruiting, new employees, especially when we talked about people entering into the workforce, it's now becoming that expectation that workplace mental health is on top of mind for employers. So, having a certification kind of shows that it's not just a talking point, you've actually put yourself through a process that evaluates these things. And finally, this is more of our aspirational goal for this program, but we want this to be a collaborative process between Bell Seal recipients and MHA. So helping to infuse a mindset of mental health into every facet of that organization's operations, but also how can we work together to do more than just this. So the program's very flexible in terms of how engaged you'd like to be with us as an organization. Some become certified and they like to promote that status. Other like to do things that not only working with their staff internally, but how can we reach out to our community and the communities that we serve with our organization. So there are 4 levels of recognition: bronze, silver, gold, and platinum. The majority of our current recipients are at gold and platinum, and then we have a few who are at bronze and silver. What you see here, and if you go to mhanational.org/best employers, you'll find this pre-assessment. So it's basically a 22-item checklist that kind of gives you a preliminary level of recognition for your organization. So we've had hundreds of companies who've taken this pre-assessment to get a sense of where they're at. Is this something they want to pursue? Where where do they need to be? Where do they want to go? And about 50% of companies that complete this pre-assessment do not qualify for any level of Bell Seal certification. I mentioned that to say that, one, it's not an easy thing to obtain, but if people are kind of putting into the work and have been thinking about this, it's certainly doable, but it is a recognition that should, again, resonate with the company who chooses to go through this process. And then, so I'm going to walk through the 4 different categories that we have as part of this. So we call it, it's a holistic Bell Seal evaluation that considers the entire employee experience. So we're looking at workplace culture, we're looking at benefits, compliance, and then wellness programs. And I'll go into this a little bit more detail, but workplace culture and benefits are going to be the largest and most important features of the application. The entire application is out of 100 points, and each of these sections are 35 points. And then it's followed by compliance at 20 points and wellness program at 10. And I'll kind of explain a little bit of why it's weighed that way. But we'll start here with a supportive workplace culture. So what are some of the things that we're looking for? And also, before I dive into this is kind of like a brief overview of what's part of the application. But if you do go to that mhanational.org/best employers, like I said, you'll find that pre-assessment, but you'll also find the full set of application questions, which I'll talk a little bit more about in just a second. But if you wanted to see the specific questions, you can find those there as well. So starting with supportive workplace culture, the first thing that we look at is having a tailored and responsive approach to measuring and addressing employees' needs. So I know going into the development of this program, it was really difficult to pinpoint the types of things we wanted to evaluate because of how different every industry, organization, the size of an organization, the region that it's in, the communities it serves. There's a wide range of things that we wanted to cover, and they're all different, and every workforce's needs are different. So, and usually when companies come to us, they're like, what's one thing we can do to get started now? I'd say survey your employee population, but make sure you're asking the right questions, making sure you're asking about things like stress and burnout, but also specifically about mental health benefits and some of the things that work for people, or maybe some of those other resource supports that may not seem like they're directly tied to mental health, but do have a big influence on employee mental health outcomes. So we look at things like, satisfaction survey, engagement survey, well-being. It doesn't matter. Any survey that you've implemented within the last year that has certain survey items asking about those things. Also, as part of that, a really big piece of this workplace culture is what was done after you received the results of that survey. Was there a policy that was changed? Was there a program that was added? So one example of a company that we work with, they realized that a large portion of their workforce were working parents, and they've experienced their own set of challenges when it came to the pandemic and everything that's still going on. And then they went back and revised a lot of their policies that affected employees with children and other dependents. So just understanding that's where the needs were, help them use their resources to best fit that. The next part of this is having a designated team or individual to address mental health concerns in the workplace. So this could also be related to just improving workplace culture in general. Examples being a culture council, a chief wellness officer, wellness coordinator, employee resource groups. So anything that's it doesn't matter what the name of that might be. It's just making sure that there's a group of people who have a budget, the resources, support from leadership, allocated time that doesn't add on their already long list of to-dos as part of their job. Another big part of this section is mental health education and training. So we do ask about the organization's broader mental health strategy. And we do a lot of these questions we leave really open-ended because we want whatever your response or approach to this is in your own words or the words of your organization. So that could be, this is a strategic priority for our organization, or it could be we've decided to implement mental health first aid for our leadership. But whatever the strategy is there. Is something, are mental health resources incorporated with a new employee orientation, or how are you thinking about these resources and how you can deliver, communicate that in your existing policies and practices, offering online or in-person mental health training, whether that's mental health first aid or some type of other training. And we do have a list of recommended trainings. So it goes from everything to like just understanding the acute signs of stress and burnout in an employee as a manager, or how do I build a collaborative relationship with my direct report as a manager. So there's a wide range of different topics that we do recommend as part of that. Got to take a moment to breathe or I'll forget. Sorry about that. Okay. And then the next piece of this is we talk a lot about fair and effective management. This is probably my favorite topic and favorite section of this. So, everything that we've done, all the research that we do. Also, we do have a report coming out in April that talks about this, but points to just the relationship that employees have with their coworkers, with their manager, with their people in their immediate circle that they interact with on a daily basis, how much of an impact that has on their mental health and well-being. And anyone who's ever been employed knows what it's like to work with difficult people and people that give you energy and people that deplete it. And that has a really big impact on how you go home and how that makes you feel, and how that affects your mental health. So we do talk a lot about having fair and effective management, and really anyone who's a people manager shoring them up so that they can feel prepared to handle these situations. Again, we do have a list of recommended practices for that, including, checking in regularly with direct reports, whether that's weekly, monthly, daily, it really depends on that relationship. Having open door and flexible policies, providing emotional support to employees, which is interesting because I think that's something that's kind of emerging as a more acceptable thing in the workplace. But there are definitely companies I've worked with where like we explicitly cannot ask people how they're doing. We don't ask about feelings. Like there's a strict boundary and line between those things. And others are like, if we don't talk about how we're feeling and the stressors that we have, it just kind of contributes and contributes to things like burnout. And we lose employees that way. So we do include providing emotional support as an important feature of that. Among like several others, which I won't cover them all, but they are listed again in that application itself, so you can see that. The final part of this workplace culture piece, so professional growth opportunities, professional growth and development. So anything around, and this really is just about an employee's agency and autonomy that they have over their work, and feeling like they have a sense of pride and purpose and meaning with their position. So we include things like internal promotions, merit-based salary increases, mentorship programs, education reimbursement, that sort of thing. Okay, so the next second category that we have is our benefits section. Again, probably the second most important piece of this application. There are 4 main things here. So we look at health insurance, we look at paid time off, disability benefits and wage coverage, and then employee assistance program. So we want to ensure that, for health insurance, employees and their families have access to affordable, quality, and easy to understand health insurance that covers mental health services and substance use services at parity with physical health services. This is required by law. Parity is required by law, but oftentimes it's a little bit confusing, the language. You just want to make sure that the service that you're offering is at parity. For PTO, it's one thing. We do ask about the amount of hours offered in terms of PTO, but I think the more important piece of that is how employees are actively encouraged to use it. Some examples, one example recently that I heard is there's incentives in place to take 5 consecutive days off. So making sure you take 5 days for a staycation or an actual vacation away from work instead of just using them one off, which isn't a bad thing either. Time away from work is always important, but adding those incentives for people to actually want to use their time off. I've seen it written in as a management expectation so that managers are asked to make sure that they are checking with their employees and reminding them to use that time off. We look at things like, does the employer offer paid disability benefits and adequate leave for mental health conditions or substance use recovery? And then finally, and this is an important piece, does the employer offer robust and accessible EAP that supplements but not replaces the employer's overall efforts to improve workplace mental health? So like I mentioned, it's 100 points and there are different things, different point values assigned to different items. And for EAP or a similar program, it's about 6 points out of 100. So it's not a large piece of this application. And we have had, a reason that we do this is because we don't want the EAP to be the be-all end-all solution to workplace mental health. We want companies to continually strive to do more and improve that. But there are definitely organizations they're smaller, they have fewer than 50 employees. They don't have an EAP. It just doesn't make sense financially to invest in that, but they do it in other ways or supplement in other ways. And they've achieved gold and platinum level certification. All right. Again, I am breezing through these topics. So if you do have any specific questions or you want me to expand on any of these sections, please drop a question in that Q&A or in the chat, that's fine. And I'll be happy to answer at the end here. So we should have plenty of time for that. So our third section here is caring beyond compliance. So this is really looking at diversity, equity, inclusion, and how that intersects with your mental health strategy. So, are there DEI considerations as part of that mental health strategy? We're looking for representation, people of all identities and backgrounds to be represented in leadership and in the workforce itself. And this includes, I think there's one question in particular that's like, is there a person who is open about having a mental health condition that serves as on either on executive leadership or on board of directors? Also, are you implementing formal policies and practices that contribute to that inclusive culture? Are you thinking about these things in your recruitment and retention strategy? And then the other half of this is more how are companies going above and beyond compliance? So we talk about ADA, we talk about FMLA, return to work policies. We ask about a reporting procedure. So there's a bunch of different things in that area as well. And the whole point is, is there preventative policies in place that create that culture where employees feel encouraged and feel safe to ask for help? it's one thing to have those policies and procedures exist, but if that culture doesn't exist where employees feel comfortable accessing it, then it's not really doing a whole lot to help. So really, this is where that section covers. Alrighty, and then the final piece here, so holistic wellness at work. This is going to refer to colleague support. Again, very loosely defined. This could be anywhere from if you have instant messaging between colleagues, like a space dedicated to talking about workplace stressors or mental health concerns or workload management concerns. It could also be virtual or in-person support groups. We saw a lot of companies doing that at the start of the pandemic, where they were used to seeing each other in person. That was a big part of their culture. And they started hosting support groups to kind of supplement that. It could be a formal peer support program at your workplace. So very loosely defined, but just some type of colleague-to-colleague support program. Additional resource support. So anything outside of like your like common mental health benefits. So this is family assistance programs. This is financial education and planning. This is recovery-friendly workspaces. So again, it's a very broad definition of what that means, but anything that, you know, if we're going back to like surveying our employee population, and we know that substance use is a really big concern for our workforce, then having recovery-friendly workspaces would be something we would include as part of that. We also talk about remote work options, which we are an advocate for, but really it comes from the perspective of the employee and what works best for their working style. And it's not something that's available to everyone, given the industry or the tasks that need to be done. But it is something we include as part of the application. We also talk about flexible work arrangements. So this could be something as simple as if an employee is able to restructure their schedule so that they can get an appointment with a mental health professional, a therapist during the day, and then work an extra hour at the end of the day, because that's what the availability is. So being able to restructure that schedule to meet the needs of that employee. And then the final piece, and then we'll take a break and do another question here, is a physical wellness program, because we know how important and how connected physical and mental health are. And that's, you know, taking that holistic approach and making sure we're thinking about both of these things. So, with all that said, is there any information that's been shared so far that surprised you? It could be anything. If there's anything here, you're like, oh, that's something I'd like to take back, or like, oh no, like I don't know about that. That wouldn't work for us. I'd love to hear it. Please, you know, feel free to drop that in the chat. If nothing surprised you, then you can stop watching this webinar and start your application. No, I'm just kidding. Please stay. But yeah, anything here that just you're like, oh, I don't understand how that's tied to mental health, or I don't understand why that's important. Let me know, share it with other people. I know when I first entered into this space, I think the most surprising part of all of this was that management piece. Just thinking about like my own personal life and the way that I interact with my coworkers and manager, I'm like, yeah, they could be stressors, but they're also a really big part of my support network. So, you know, it just kind of contributes to this larger conversation of like, how does our daily interactions and the way that we work with people influence our mental health and the way that, you know, we operate in the world. So I know for me, that was a really big thing, was like, oh, wow, like this is what we should be focusing on, is training up our people managers, like just emotional intelligence in the workplace. And what does emotional support look like, but while maintaining like healthy boundaries. So, you know, it was surprising information to me, but also very exciting. So some of the things that you have here, let's see. I'm not sure where we started, so that's okay. Yeah, surprised by the comment that 6% for EAP. Yeah, we're big fans at looking at the full picture, so that's why it is such a small percentage, but we still include, because we do think that is a really important resource for employees. Representation, leadership. Yeah, this was really interesting, because we didn't initially, like I mentioned, we've been through a lot of different iterations of this program, and we didn't initially ask for that. I think the question was originally, does leadership speak openly about mental health in the workplace? And when we were talking to different companies, what we were finding is that like it was falling on deaf ears. People didn't really, it felt like the communication was there, but they weren't receiving the message because they're like, well, what do you, what do you know? You're the leader. You don't know what it's like to be in our situation. Or, if they weren't talking about dealing with their own mental health concerns, it just felt a little flat. So that's why we did change it to be like, is there that representation? Has there someone who's disclosed that and shared openly? It just seems to resonate with staff a little bit better. Emotional support. Yeah, that's my favorite. The first time a manager's like, yeah, it's okay to cry. Like, I'm stressed too. I'm about to fall apart. I'm like, yeah, same. Like, just having the freedom to express myself and not feel like I was going to get judged for that took such a load off. It didn't change the amount of work. It didn't change like the world was falling apart. It still felt like it was falling apart, but it just changed my reaction to it and feeling like I could be safe and comfortable with this idea of emotional support, what that means with a manager. So great. Thank you so much for sharing that. So now I'm going to move into the second half of this, which is the actual logistics of the program and how you can get started and the application itself. So I'll walk through the full process, and some of you may have already done some of this and some are just getting started. I do want to point out, so for our 2022 year, the deadline is March 31st. So we got a little less than 2 months, but it's still enough time to get started and get started with the full process. But the first thing that you want to do is submit an employer information form, which is just your name, email, organization. There might be another question or two as part of that. Again, you can find access to that form at that mhanational.org/bestemployers. I think it's get Bell Seal certified, and it'll take you right to that form. It's also available with this link here. So once you complete that, you'll receive an email that has access to the online application. So it is an online application. This is what you finally submit and kind of move forward with the process. The application itself has 58 total questions. It is broken down into those 4 categories we just talked about. They're all yes or no questions or fill-in response. And then we have 8 open-ended questions as part of that. We used to require documentation until we realized that was a huge burden for employers, and it just really wasn't necessary. I think we get the most meaningful information out of those open-ended responses when we get more of the philosophy around an organization's approach to these types of things. Again, it is a lengthy application. We don't have any documentation, but some of this does require information outside of, you'll pull information from HR, sometimes from your comms marketing team, from your employee resource group. So it does take a little bit of time to kind of compile all the information that you need for the application. In terms of the online application, some of you may have already started that. Please don't, if you cannot find the link to that, because you are able to save and return, just send me an email at tadams@mhanational.org, and I can send you the link to your application so you don't have to recomplete it. I don't want you to do any more work that's already involved as part of this process, but just send me an email and let me know. And happy to kind of navigate that and send the link to your application to complete. There is a cost associated with the application. So it ranges from $100 to $300 depending on the size of your organization. This just covers the cost of time for the evaluation itself and some of the supplemental materials that we provide after. Again, that deadline is March 31st, 2022. This is a annual certification. The program didn't originally start out that way, but we wanted to do this so that for organizations that did land within bronze or silver or may not qualify yet, they can benchmark their progress year to year. So we reach out and we do outreach in January of each year. It's not the same process of filling out the full application. It's basically, here was your previous application. Are there any changes to what you submitted in the prior year? And also any questions that we may have added or taken out, because we do update the application year to year. So after you've submitted your application, it usually takes within 5 to 7 business days, usually sooner, to receive your results. We schedule a 30-minute virtual meeting to review those results, talk about, each of those 4 categories. What are some of the things that you can do to improve your score? What are some of the things, and then we talk about next steps. So this is in how we promote your Bell Seal status, but also talking about some of the ways that we can work together, if that is something that you're interested in doing. And then our full list of recipients will be announced, and we do announce them on a monthly basis. So as you apply, people who've applied back in September for this year, like, we did announce it as we went, but the full list of final 2022 Bell Seal recipients will be announced in early June, and this aligns with MHA's annual conference, and I'll talk about that in just a moment here. So in addition to participating in this program, just because it's a really good thing for your employees, and I think everyone should be thinking about these things, but there are some just more, I guess, tangible benefits as part of it, including, we do put the logo of the certified company on the Bell Seal landing page. I'll say it once more, mhanational.org/best employers. You can see all of our current recipients on there now. We do include it across all our social media platforms, as well as our national newsletter. There's a recognition piece during the annual conference in June. Still, details to be determined, because we're still kind of figuring out what our approach to that is for this year, with everything changing with the pandemic and all. But there is some form of recognition during the conference, and that's a hybrid event. So we do have the virtual portion, and then there is the in-person portion in Washington, DC. We provide a Bell Seal recipient promotional toolkit. So that is that includes anything from social media graphics to language, the logo, the Bell Seal logo itself, that you're kind of free to post wherever. Sorry, one second. I definitely can't do 2 things at once. I apologize. What I really love, though, about the toolkit is that it includes graphics that you can use year round. So May is Mental Health Month, September is Suicide Prevention Month, July is BIPOC Mental Health Month. So you can continue to promote this status throughout the year and continue that conversation. So it doesn't stop when you get certified. This is something you should celebrate year round. And finally, opportunities to collaborate with MHA. So again, this is totally up to the level of engagement of the company and how much time they want to dedicate to something, but we do often put panel discussions together. We do blog spotlights. So if there's something that stood out as part of your application, we want to share that with other people and share that in some of our content. So there's just opportunities to do that throughout the year as well. Okay, great. So like I mentioned, of the hundreds of companies that have taken that pre-assessment, over 50% of companies don't qualify yet for certification, but they are making their way there. They're implementing things now to try to get certified in the future. I did want to share additional programs and resources that we have for that. So if you go to mhanational.org/workplace, you'll see, of course, Bell Seal is the first thing that comes up, but we also have all of our workplace research that we've done over the last decade. We have resources specific to employers and then resources specific to employees. So in terms of our workplace research, we have an annual work health survey that we put out every year. We get thousands of responses across the US, from 17 different industries, different size organizations. But we use this survey to just better understand what the employee mental health landscape looks like. How are people doing? Not well. The last report that we put out last March, there's, it indicated high rates of burnout and stress, and people really aren't doing too hot in this space. But we're coming out with another report in April, which will talk about how important each level of an organization is to the implementation of a mental health strategy. What actually matters when it comes to employee mental health outcomes. And some of the kind of preliminary findings are really interesting in that while mental health training and awareness campaigns are important in reducing stigma and starting that conversation, they don't directly translate to better employee mental health outcomes. There's also other pieces to the puzzle that help actually bring people who need mental health assistance or care or support to those resources. So I'm very excited about that report coming out in April, but all of those reports and past surveys can be found in that section, workplace research section. We also have, so the resources for employees is going to redirect to our screening to supports website. So this is access to mental health screening for depression, anxiety, PTSD, disordered eating. But there are articles written specifically for workplace situations. So one example being, I'm afraid I'm going to get fired from my job, is one thing. How do I navigate that? How do I navigate the feelings of that? And there's, several articles related to how can I ask for accommodations for a mental illness? What does that mean to disclose that to my manager? What's the process look like? And then the other half of that is resources for employers. So here's the really long link at the bottom here. And like I said, once you receive the slides, all of this is linked within the PowerPoint itself. But we do have resources for employers. It is broken down into those 4 categories that mirrors the Bell Seal category. So creating culture support, wellness in the workplace, benefits, and then that caring beyond compliance. And just an example, so if you click on each of these sections, it has a long list of articles that you can kind of go through. It is a ton of content, and I will be honest, not the most intuitive website to navigate, but there is a lot there. Just some examples of that is under creating a culture of support, we have recommended well-being survey items. We have professional growth suggestions, our full list of mentally healthy management practices. For benefits, we include things like the APAF's Center for Workplace Mental Health mental illness cost calculator. So how much is not addressing mental illness in your workplace costing your organization? There are a list of specific questions you could ask your benefits broker, TPA, EAP about, specific to mental health and substance use and what you're offering with your benefits. How to encourage employees to take time off and examples of that. For the compliance section, there's, what's a return to work policy? How does this relate to people with mental health conditions? Again, mental illness conditions from more of that HR perspective and how to navigate that. And finally, the wellness piece, we talk about emotional intelligence, how that applies to the workplace, why that's so important. Even just tips on planning a wellness event at your workplace. So wide range of different topics covered in each of these things, but I do encourage you to check that out if you're trying to build up a certain, part of your workplace mental health strategy. All righty, so we have got plenty of time here, and I'm going to see if we have any questions. Before that, I'm going to leave this up, the contact information. You can reach me again at tadams@mhanational.org. Find all that information we talked about at either mhanational.org/workplace or Best Employers. And yeah, let's see if we have any questions here. Just give me a moment. Sorry if I was talking at the speed of light, but I'm happy that we recorded this so that if you did need to go back just to hear what I was saying, it will be available. So these are some of the questions we received in chat. So first one being, do we receive any benchmarking data for other companies and what they provide for their people? This is a really great question. Would be great to see what platinum levels do, silver, etc. Yeah, so at this point we have 35 certified companies, but we were hoping to reach a certain threshold so we can start aggregating the data and be able to share that widely with the companies that we work with. At this point, it really So this is something we plan to do in the future, but not as it currently stands. Um, but this is, we do want to be able to say like 50% of companies who do this practice are platinum level. This is something that we recommend or something that other companies are doing. Now it's kind of part of that 30-minute virtual meeting that we have. It's an informal discussion to be like, oh, I saw that you do this. Here are some ways we've seen other companies do the same thing, or here's some other recommendations. So not a great answer, but it's definitely something that's top of mind and something we want to do in the future as we get more companies participating in the program. Okay, and then another question that we have here. In an organization that does not have a department directed for employee support, encouragement, advancement, and job placement, who would take on this directive? Usually it's HR, correct? Yeah, so this comes up a lot, especially when we work with nonprofit organizations or really small organizations where they don't even have an HR department, or there's one point person for that. But yeah, usually these functions do live under HR. If there's a chief of staff, if there's someone on the leadership team who takes this on. I know this isn't the exact question that you have, but we have seen a lot of creative ways in which people who have small departments or really just don't have the resources to have an entire team dedicated to this, but they've implemented things in other ways, or they've been able to kind of supplement efforts that didn't require that level of investment if it just wasn't available to them. But yeah, this would usually be something that HR would take care of. But I have seen employee resource groups who, they either self-formed or as part of a larger program at the organization, who have a lot of power and influence to be able to make changes, but they also do have time and resources given to them so that it doesn't feel like it's adding to their current workload. All right, I'm pulling up some of these other questions that we have here. And if we wrap up early, this means y'all can get started on your application, and that's that's really exciting. So we have one question here: should yes, no be expanded on, or just respond yes or no? So most of I would say majority of the questions that aren't those 8 open-ended response questions or fill-in response are just yes and no. But we do encourage, because there are circumstances where it's like, well, my company doesn't do it this way, or that doesn't make sense to me. This is how we do it. So at the very end of the application, there is a comment section that allows you to kind of fill in any information that you just missed or you want to expand on an answer. It's very flexible in the way that we have these conversations, because one, it's really difficult to measure company culture on a paper or online application, right? So oftentimes when we have that 30-minute call after you receive your results, we kind of call it our preliminary results discussion, because we'll go through some things we're like, oh, we didn't score as well here, that was surprising, what were some of the reasons, and we can kind of talk through that at that point. So yeah, they are just yes or no questions, but you do have opportunities to expand if you'd like. I have another question here. Oh, this is really interesting. Any questions and I don't know if I know the answer, but I'll say it out loud anyway. Any questions on policies, procedures pertaining to alternatives to serving alcohol at company-sponsored events? This is a really great question. Honestly, I have not come across this, but this is actually something that we've thought about within our own organizations, our own organization, as it comes, when it comes to things like event planning and making sure that we're consistent with the populations we serve, while also, having events that people attend and are excited to be a part of, and feels like a sense of, community. So I don't have a great answer for this question. I apologize, but it is a really good one, and I definitely want to do some research into this and see what we can kind of come up with for that. But thank you for that, sharing that. And then we have a couple more here. I do, as I'm thinking about this too, this absolutely doesn't answer your question there, but it does kind of go back to another thing I've been wrestling with, where when people or when companies were sponsoring virtual support groups at the beginning of the pandemic, there had been a lot of concern of like people started talking very openly about, I mean, initially they're like, oh, this was supposed to be employee resource group. And it really morphed into something where people were talking about like stressors and workplace complaints and things that probably could have been elevated to the point of needing to be reported. But there was a huge concern around this is like an employer sponsored platform. And now I just feel like everyone's like talking about like all these negative things about the organization, and there really wasn't a structure to respond to these complaints. But it was helpful to those employees who just needed a space to vent. Again, there's not a great clear resolution to that, but it just goes to show some of the issues that companies are dealing with when they're thinking about these things, and you're broaching sensitive topics like mental health and talking about stressors related to the workplace and these different things. Alrighty, so a couple more questions here. Are administrators involved in each step of this certification once we apply? So do you certify each year and you can move up a level as you, oh, that's a different question. Great. Okay, so I think I understand this question. If not, please, clarify in the chat there. So this, again, this is a very collaborative process. So we, even before you submit your application, we highly encourage you to reach out to MHA, to me personally, and ask any questions before you submit. I want everyone who goes into this process to feel as confident as possible. And we've definitely had situations in which people have submitted an application. They're like, oh, we misunderstood this question, or we found this policy and didn't realize, I just didn't get the correct answer. And we've gone in and revised that post evaluation. So, administrators or whoever's kind of the point person for taking on that application, we're very closely, involved in working together and getting the correct score and getting everything that you need for that. At no point do we, for example, if you've gone through the process, you're like, wow, this score was a lot lower than we anticipated. We're going to hold off. We want to wait until the next year and kind of, strengthen some of these areas. We don't want to publicize this. We do not post anything without that organization's permission. We want this to feel like a celebration. We want to recognize your efforts. We don't want to penalize or make anyone feel. The fact that like you're taking on this initiative to think about workplace mental health is just that in and of itself, you're already ahead of the curve. So we just don't put anything out there or share anything without the permission of the organization. So I hope that answers your question, but we do work pretty closely together throughout the process as needed. So the next question here is, so do you recertify each year, and can you move up a level as you recertify if additional data is received? Yeah, so great question. You do recertify each year and you can move up those levels. But as I mentioned with that 30-minute conversation after the initial evaluation, there have been situations that have come up where they're like, oh yeah, no, like this is something that we planned on doing within the next month. And it influences your score because we do talk about that. Then yeah, absolutely, we can make those changes before it's finalized for the year. You don't have to wait to reapply the next year to do that. But if you are like, oh, this is, we talk and we're like, wow, we really want to build out a more, a fully fleshed out strategy. There's a lot of components to this. It's going to take a while. It's not an overnight thing, so it does take a while to build that up. And you're using some of our supports and resources to do that. You can up the level for the next year and kind of wait till the next year to do that. And then I think the other question that we have here, on the website, there are 35 certified companies and 487 committed to mental health. Does that mean 35 have earned it and the rest didn't? Yeah, great. Great question. So as part of, so that's not the number of companies that submitted applications, 487. These are companies that have received training through Workplace Mental Health, have worked with some of our other Workplace Mental Health partners, have started the application process and are still currently gathering information to submit their final application. These are some of our workplace partners that we've worked with in the past. So this is just a wide range of catch-all of people who have shown explicit interest in the workplace mental health space. Many of them are in the process of applying. And just for reference, there's only, of our certified companies, there's only 3 or 4, and I won't disclose any names or anything, who did not meet any level of certification. And I think, using that pre-assessment tool was a really good way to just see where you fall. I think it's a pretty accurate way to determine, like, okay, maybe we need to hold off before we actually apply. So there aren't many companies who come, and once they actually submit the application, they don't achieve some level of certification, because we're often working with them a little bit before that step of the process. If that makes sense. All righty. So we've got about 4 minutes left. And if anyone needs to hop off early, start that application, you're welcome to do so, or just have another call. Again, this will be recorded. The slides will be available to anyone who wants them within a couple business days. I will stay on and just answer if there's any other questions here, but please feel free to hop off so I don't take up any more of your time here. Well, just one question here, very simple. Is there only one deadline per year for applications? Yes, so March 31st is that one time, because we do want to align it with the activities that we host at the June conference. But the application cycle reopens in, I think it's September of the same year. So 2023 applications will open in September 2022. So if you want to take the summer to prepare an application, look at the questions, take your time, that application cycle does open up again. All righty. Okay, I feel like I've talked at you enough. So I just want to say thank you so much for joining me. Thank you for all your questions. I apologize for the ones that I wasn't able to give a really good answer for, but you give me a lot to think about and something I want to go back and do a little bit of research on and come back with that answer next time. Please reach out, tadams@mhanational.org. Thank you again. Any questions, of course. And yeah, hopefully we'll be in touch. Thank you all.